Good morning.
Good morning.
I'll be your nurse today. How are you feeling?
Doing well. How are you doing?
Not bad, not bad. Now, can I get your name and date of birth, please?
Alan Jackson,
Mm-hmm.
2008, 9001.
Okay, sounds good. All right. Now I'm going to provide privacy for the patient by pulling the curtain and raising their bed up so I can perform the assessment. All right, Mr. Jackson, I'm going to be performing your vital signs today and also getting a pulmonary and cardiac assessment on you.
Sounds good.
All right, now all that entails is that I'm just gonna be listening to your heart a little bit, listening to your lungs, checking all your pulses. I'll be in and out of here 10 minutes.
Perfect.
Perfect. Okay, sounds good. I'm sorry these beds take forever. I just gotta raise it up so I don't hurt my back, you know?
It's understandable.
Yeah, I already got a bad back as is. All right, now first I'll be getting their blood pressure. Okay, Mr. Jackson, I'm gonna be getting your blood pressure real quick. This thing around your arm over here, it's gonna be squeezing down a little bit. Just don't worry. All right, 128/68, looking good, Mr. Jackson.
Good.
All right, now I'm gonna be checking your pulse, okay?
Sounds
Okay.
alright.
But while I'm checking his pulse, I'll be first checking his respirations. Okay, starting now. His respiratory pattern is normal. There's no labored breathing as it seems. It's very one after the other. And right about now, he's at 16 respirations in a minute. That is perfect. And now I'll be starting to take his actual pulse on his wrist. All right, we're done. He has a normal rhythm of 80. It seemed very spaced evenly between, very normal heart rhythm. All right, first I'm gonna be working from head to toe. So I'll be checking his, assessing his neck for jugular distension, in which he doesn't seem to have bilaterally. Then I'll be checking both the carotid arteries for a pulse. There we are. Now checking this side. Bilaterally even and strong. Okay. Now I'll be listening to his carotid arteries with the bell of my stethoscope so I can listen for bruits. Sounds good. Sounds good. All right. You're sounding good, Mr. Jackson. No bruits in your throat, which is the turbulent flow of blood through the carotid arteries. All right, Mr. Jackson, is it okay if I expose your chest here for a second?
It is. Can you tell me what my temperature is? My head kind of hurts a little bit.
Oh, your temperature. Okay, yeah, of course. Must have forgot that in the assessment. I have to go grab the little gauge real quick.
You're good.
Okay. All right, pop that thing in there. Beep. Okay. Your temperature is 98.8, Mr. Jackson.
Good.
Alrighty. And let me just go ahead and put a pulse oximeter on your finger while I'm here. There we go. It's on your finger. Alright, that usually takes about 30 seconds, so we'll wait here. Beep! Beep, it's done. Okay. Okay, you're sitting at a pulse ox of 99. Very good, Mr. Jackson. Alright, let me take that off. I'll be using that here in a little bit as well. Alright, now I'm going to be moving down to the chest of the client. Mr. Jackson, are you okay with me exposing your chest here for a sec?
That works.
Okay, I gotta listen to your heart and lung sounds real quick. Okay, now I can't listen over the clothing of the patient. That is a big no-no. So right now, I have his chest exposed, and I'm going to be listening on his actual skin. So I will be listening in the second intercostal space down at the aortic pulse. Sounds good. Now I'll be moving over to the pulmonic. Bilateral, same position, second intercostal. Then moving down, I'll be in the Erb's point, which is in the third intercostal space on the left side of the septum. Okay, I'll be moving down even farther to the fourth intercostal space down. This is the tricuspid valve. Okay, there it is. And then mid-clavicular line, fifth space down, would be the mitral valve. Sounds good. All right. Now that I got him here, I'm also going to be listening to his lung sounds with his chest exposed. Okay. Now, Mr. Jackson, I'm going to need you to take some deep breaths for me. Okay. Whenever I say take deep breaths, just take a big deep breath in through the mouth and out through the mouth for me. Thank you. Sounds good. All right. All right, you're sounding all good, Mr. Jackson. Your lungs sound normal, and after that, I'm going to be using the bell of my stethoscope to listen to your heart sounds. It just catches up different sounds, so I'll be doing the same thing with the aortic pulse in the second intercostal space on the right side of the body. Sounds good. And on the bilateral side, still second intercostal side of the left side. Sounds good. At the pulmonic, and now down to Erb's point, the third. Sounds good. And now we're going to be in the tricuspid valve of the fourth. And then the mid-clavicular line of the fifth is the mitral valve. All right, sounds good, Mr. Jackson.
Good.
All right, now I'm gonna have you lean up here for a second, okay?
Sounds
I gotta get
good.
to your back.
Alrighty.
Okay, leaning you up because I'm gonna have you lean forward for me so I can get to your back so I can listen to more breath sounds, and just make sure your back's all right. Feel it a little bit. Make sure there's nothing wrong.
Sounds good.
These beds, they never work, do they?
That one seems to give you some trouble.
It gives me a lot of trouble, Mr. Jackson. Okay, now I'm going to lean you forward. Okay. Okay, Mr. Jackson, can you take a deep breath for me? Okay, great expansion on that. Okay, now I'm going to need you to take another deep breath every time my stethoscope touches your back, okay? Okay, thank you. Thank you. Thank you. All right, that seems all good back there. Okay, I'm gonna lay you back down. You all comfy?
Yes,
Okay.
sir.
Okay, now I'm gonna palpate your chest a little bit.
Whatever works.
All right, I'm gonna be feeling for any bony prominences, anything that's out of place, anything that I just don't think is right. Okay. He feels good. All his intercostals are where they're supposed to be. All right. Okay, now I'm going to be working down to the arms. I'll be feeling for a brachial pulse. I got it. I'll be feeling for another brachial pulse on this side. Got it. All right, I'm going to get your arm out from there. Let's actually cover you back up since I don't need your chest anymore. Okay, radial pulse. We got it. Now, bilateral. We got it. Okay. Your pulses on both sides seem very even, very normal. I'd give them a +2 on the rating scale, and they're even bilaterally, +2 both ways. Alrighty, Mr. Jackson. Your hands are looking good. There's no presence of pallor, cyanosis, no skin breakdown, no hair loss, from what I can see on both sides. Now I'm going to be taking his middle finger right here. I will be performing a capillary refill test. I will be pressing down very hard, not very hard, but hard on the nail, and for 5 seconds. releasing. And it was less than 3 seconds, so it's within the normal range. Mr. Jackson, there you go.
Perfect.
Okay, now I'm going to be moving down to your feet. Is that all right?
That works.
All right. Okay, let's expose your feet here for a second. Sorry, it might be a little bit cold. Okay, now I'm going to be looking for the dorsalis pedis pulse. There we go. I found it. Now I'm going to be feeling for the posterior tibialis pulse. I got it. All right, now let me move to the other side so we can see if we have bilateral symmetry. Looks good. All right. Move to a few different spots. All right. I can't find your the posterior tibialis pulse, so I'm gonna have to go grab a Doppler real quick. But we don't have a Doppler in the lab right now, so I will just be simulating that I will be using a Doppler, and I know the procedure for it.
Perfect.
All right. Well, is there anything else you need, Mr. Jackson?
I think I should be good.
You think you should be good? All right. Are you comfortable?
I'm very comfortable.
All right. Actually, let me lower you back down a little bit. You might be. I'm gonna have to get someone to come in here and help me move you up in bed.
All right.
That's a story for another time.
Ay, ay, ay.
All right, I'm gonna flatten you out real quick, and then we're gonna lower the bed back down so you don't. You're at a lower risk for falls. All right, we don't want you falling out of bed when you don't really need to be, huh?
Sounds good.
Yeah. All right, let's just lower this down real quick. I'm again very sorry. It is a slow bed. How's life? Okay. Do you need anything else before I leave, Mr. Jackson?
I should be good.
All right, sounds good. Perform hand hygiene, and I will be going back.